Right. So hopping to first thing. So accuracy is not just accuracy. As you can notice, we have clinical accuracy, we have practical accuracy, functional. There is a lot going on here. Um, and that's why it's so important to have all these things, the idea about that. So that's why we'll go through this. Okay. So clinical accuracy, um, and what it actually means, like what is the requirement for this? Um, well, it's go way more beyond uh, your vocabulary. So it's kind of going in a couple levels. And let's say we have um, words like, let's say, pain. But if we will go for kind of a schematic accuracy here, and there is a different meaning of pain, the patient can say discomfort, for example. They will not exactly use the word pain, and that's where you can see the bulb glowing right now, that you need to be aware what is going on, right? Another thing that might be also related will be, let's say, pressure. So sometimes, yes, the patients will say like, oh, I feel like I have a high pressure, or I feel like something is happening with my pressure. But the other person will say, I feel kind of tightness in my body, for example. So in that case, again, that accuracy here is important because they need to understand around in the whole room what is going on, right? So again, you cannot change that word. You need to understand exactly what they're talking about and what is the context here. And that's why that word need to be still delivered with the exact meaning, pretty much. Now, for if you are a medical interpreter and if you will start translating something different, there'll be different word, different meanings. So in that case, your medical interpretation will might affect all the different things. And we're talking here especially about the diagnosis. What if it's going to be misdiagnosed now? And then something will gonna happen, right? Um, Again, there might be a different treatment for the patient, which will not even help the patient or can even hurt the patient. Um, there's they can be in stress after that. They might be also feel angry that well the doctor didn't help them because you did not provide the correct interpretation, accurate interpretation, and whatever the patient wanted to say, eventually doctor pretty much just ignored because according to the interpretation that it was provided, um, the doctor assumed like, okay, it's nothing serious, right? Um, so you have to keep in mind as a medical interpreter here that number one, um, for the accuracy is the patient safety. That is number one golden rule that you need to remember whenever it comes to accuracy. They have to feel safe. They have to feel they have provided the correct diagnosis, correct medication, correct treatment, and there cannot be like there is no room to do something wrong in this case. Trust in the healthcare, that's another thing because in this case now, if you have a patient who complain about their health, they feel bad, they feel sick, and you provided wrong interpretation, you changed the words, or you missed some words, and the doctor said, okay, so yeah, you are fine here, just take some Advil and go home, you're gonna be fine. Eventually, patients will start trusting the healthcare providers, right? Um, and that is something that will affect them in the future. And it's very problematic, and you need to keep that in mind, that in that case, that trust, if the patient will lost that trust for the doctors and healthcare, they will not blame you, they will blame the healthcare, that they didn't provide the help. They are assuming that whatever they said, you have translated that correctly, and so there will be no complaint from you because they did not understand what you were saying in English. But in this case, they will lose distrust for the doctors. Well, your professional credibility, that is something very important in this case, because if you're going to make mistakes as an interpreter, and those mistakes will show up more often and often, eventually, well, I mean, worst case scenario, the interpreter can lose the job, right? Because that interpreter will not be any more trustworthy. And we, as a company, for example, if we take our company, we cannot send the interpreter that we lost trust into, and there's like so many issues, so many complaints about that. So that's something that you have to keep in mind, being an interpreter. So if you'll just collect all these things together, it's kind of like it's now make more sense that all these little things are connected together when it comes to accuracy, and a lot of people eventually might be impacted by your accuracy. So that's something that all interpreters who want to participate in medical and legal settings need to understand how important it is, and why actually I'm talking for this about this for the last 2 weeks. Now, the next one, we have the practical accuracy. So here, in this case, you are watching the person. So that means you're catching the content of the conversation, right? So if there is we were talking about this yesterday with the victims and witnesses. So if there's a hesitation from them, if they don't want to answer the questions, for example, if they're minimizing the problem, they feel maybe shy a little bit, or there's anything happening, you as an interpreter, you have to know how to read the room. You need to know if that person actually suffers, but do not want to tell that. And you, in this case, eventually will have to also let the doctor know about this, right? So like a good example, let's say there's a patient, a doctor, so the patient is sitting there on the chair, and the doctor is asking them like, what is going on? And the patient will say, well, I don't know, probably it's nothing, just a little pain happening. But here you can already see this pause between like nothing, a little bit of pain. So you as an interpreter, you have to kind of like figure out and read that person already to see that something might be wrong. Because when that person is uncertain about like, about revealing the pain and where is the pain, that might start the problem in the future for that person as well, right? So you as an interpreter, you still kind of like, even if you're providing the interpretation, just verbally, but your eyes are still open. So you have to see what is going on, especially, I'm guessing, correct me if I'm wrong, but probably in all our countries, elders are doing that a lot. When they're going to the doctor, it's like, oh yeah, nothing. I just lost a finger, but I don't feel anything. It's okay. So it can happen sometimes, and that's where the interpreter should know and be aware of the situation. Another one, we have the functional. So functional accuracy in this case. Here, the interpretation, so the interpreter kind of allowed the provider to, whenever they're making a decision, and if there is no huge barriers, language barriers. So we were talking about this, I think, last week, where let's say the person also speak a little bit of English and understand basic English, and now they're going to start talking to the doctor, and the doctor, let's say the healthcare provider, going to talk to the patient. So in that case, if it's happening, you can allow this to happen to some level. So here, you will start noticing when the person is going to start struggling to understand words, and will start to struggle to speak or answer the questions, right? Because eventually their accuracy going to get lost. And when that's going to start coming, and now they're going to answer the wrongly to the questions, there'll be wrong answers, or they're going to start providing wrong information. That's where you have to step in. That's where you have to step in and tell the healthcare provider that you can take it from here now, and you will help the patient, right? So technically, in all those three types, your role is to read the room, because now imagine that you are sitting in the room and you guys are sitting in this little triangle here. So you have the healthcare provider, you have the patient, and you have the interpreter. So kind of like a triangle, right? And your main job here is to keep that balance between in the middle of this triangle. So again, you have to interpret everything said by both sides. Again, if they're able to speak in the basic English and they're okay with that, you can stay on standby. But if not, you have to start stepping up for this. And then again, you have to interpret everything word by word for both sides. Your first person speech, well, we're talking about this all the time. It's very important, because now, as an extension of your of the voice of the client, it's totally different and more respectful as well for the patient. Whenever the doctor gonna talk to them, they have to talk to them, not to you. So you can also educate healthcare providers that the conversation is between you and the patient, not between you and me, right? Again, you are watching the room in this triangle. So the tone of the voice, that register that happened, what is the emotional content here? What is going on? If there's any signals that you need to be aware of, that any red flags that you have to maybe tell the doctor. So that's something where you have to be aware of the entire situation and help those two parties as much as possible. If we're talking about something opposite, well, imagine if there is an interpreter just sitting on their phone all the time and talking from time to time, like, oh yeah, he said this, and yeah, she said that, and then going back to the phone, doesn't even look what's going on. Well, eventually it can end pretty badly for the interpreter. So just keep that in mind, that you are very important over there for the accuracy purpose. So the high risk areas where the accuracy is important because it fails. So all the high risk areas, when there's a dialogue about the symptoms, what are the actual symptoms of the patient, and the patient, let's say, will not speak in medical terminology. So you have to keep that in mind. They will not speak in in medical terminology, and that's where the accuracy is coming, because you also need to figure out uh, how you can use this clinical accuracy, and what is the meaning in that case. So, for example, if the patient will start talking like, I know my heart is beeping like it, and it feels like it's tired, right? So in that case, you will have to provide the information and most likely provide the meaning of that word. Maybe a person will say like, oh yeah, I feel like my stomach is totally like hot. I feel heat in my stomach, right? So again, you can you can deliver that message, but still you have to provide the meaning of that, because now the doctor need to start asking questions like, what does it mean? Why do you feel that heat? Where exactly do you feel that heat? What might be the reason you feel the heat, right? Because even if you do not exactly understand what they're talking about and you deliver that message with a quick meaning, it will very helpful for the doctor, because now he can start asking the correct questions to the person. So whenever patient is talking in this non-clinical terminology, you are still trying to only deliver the message. You do not try to answer the questions to them. Especially do not try to provide like any friendly quick diagnosis to them. Like, oh, if you feel the heat in your stomach, well, maybe grab a glass of water, you'll be fine. So yeah, you cannot do that, right? It's that is very important, because even if anything that they will say sounds a little bit vague or not clear, or it's not very medical, eventually doctor gonna figure out what's going on. And all doctors and healthcare providers, pretty much, they are trained for this. Like that's where they have the school and big diplomas, and they're trained for that, to recognize the symptoms of the person. Even if you understand the symptoms, like you can recognize it right away what they're talking about, it is not your role to take the responsibility to provide like any friendly advice in this case, right? So those are most of those high risk areas where it can happen when those symptoms are coming up. Another one, which is very serious, is the medication and the dosage of medication. So in this case, yes, you have to be absolutely sure that your message is absolutely perfect. So whenever you have to start interpretation, keep in mind that you guys gonna talk about the numbers, frequency of the dosage, like what are the units. So in that case, you need to understand that whatever the person will say, you have to totally the same way provide that information. Now, if the doctor said, okay, that's something wrong, and you start interpretation in your language, and maybe the person got mistaken. Now they're going to provide another number, another unit, another dosage, right? So in that case, they can, again, the healthcare providers eventually will figure it out what is happening, right? Same thing if they will not provide the numbers. So if they are not sure, you cannot assume anything here. So if they will say, yeah, I took it like today a couple of times, and then you will try to like, again, go with that approximately numbers for the doctor, and you will say like he took it a few times, well, it's gonna change. It's going to change the meaning and it's going to change the number eventually as well. So again, even if there is no actual numbers, no units of dosage or anything like that, and they just say how are they taking it, it still need to be delivered in the same way. Very important, if you cannot understand what either of the parties says, in this case, it's very important to ask, can they clarify? Can they repeat that? If they are, if they mistaken or they not speaking very clearly about the dosage, for example, or like how many units they're taking, how many pills, and you are not sure, don't guess, don't assume. Again, you have to ask clarification. Even if you have to ask 5 times, it's very important because it will affect the person and it can affect in a bad way eventually. So here, you need to be sure that there's no games when it comes to accuracy for medication and dosage for the patients, right? Another part for the high risk will be whenever it comes to any consent. So it's kind of like one of those critical responsibilities where the patient must understand, let's say, risk of the treatment, when they need to understand benefits of the medication, if they need to know about any alternative option for their treatment, for example, right? So again, you have to be sure that what you interpretation you provide is provided with every detail of those information. Every question from the patient need to be provided accurately. Any fear, any hesitation from the client, all those things need to be provided in the same way, because that conversation is important to so the doctors can figure it out when they have to introduce those things to the patient, right? So again, you cannot summarize, you cannot simplify anything here. Everything needs to be said in the same thing, especially when, let's say, there are very serious cases, and now we're jumping into mental health and situations where any like mental health events are happening. So if there will be any like a wrong conversation, maybe the person is already on some kind of drugs, the person doesn't want to talk, the person is emotional in this case, and now they're talking about those risks, those benefits, they're talking about medication here. So those conversations can be a little bit more challenging, and the interpreter need to be aware how to proceed that, right? So again, you must look into those, like exact wording need to be provided. Look for the tone of the people speaking, if there are any emotions in that, how they describe the situations, like if they are talking about, let's say, if they're sad, they are angry, they can say a lot of different things about their emotions, and you need to know how to deliver the same message to the healthcare provider so they can understand what is exactly happening and how they can help with that, right? So, for example, I think the best example is if there is, let's say, a person with a depression, and you can probably hear it many times from people whenever say, I feel empty, like I feel empty and tired, right? But now if you will kind of say like, oh yeah, the person feels sad or doesn't feel like want to talk today, Yeah, it can change a little bit, because those are two different things for the, let's say, the healthcare provider who is working in this in the mental health, and based on that what they're gonna hear. So let's say empty or sad or any other words, those words have meanings for them already, and they know how to approach the person. So again, don't assume and do not change anything. Always provide the same wording for them, right? How you can manage those situations. So here basically are where you put the boundaries on it, because there's a lot of different situations happening. And again, we talked about this before. You are just a human, and sometimes you feel like you can help, or maybe you should help, or maybe it's a good thing to help. Um, but those are the boundaries that when you will cross and step out, that's where the problems can happen, right? So again, if we look for the actual definition here for like what are those boundaries? So I would say you can go for three categories here. We have the mental boundaries, emotional, and well, the physical boundaries as well. So it all depends, because now those boundaries for all those three types will it's kind of define you as a person who accepting behaviors of other people, and also the other people will accept your behavior, right? um and here it's kind of when you need to also separate, because those boundaries not always against someone. Those boundaries can be you can set those boundaries for yourself. So in this case, you need to recognize the difference between the need of doing something and the feeling that maybe you should help, right? Um, so here you have to understand what is exactly going on, and how you can also set up those boundaries in this case, right? So like if we look in let's say like a real life kind of situation, um, if let's say you will see kind of like a misunderstanding between the doctor maybe and the patient, and suddenly you are kind of like hopping into that conversation. So again, just imagine that triangle, and everyone are sitting in their spots in this triangle, and suddenly there's that misunderstandings. They kind of try to argue, and now you hopping inside that triangle to separate those two, and you feel like you have to explain to the doctor what the patient wants to say, right? So that what you feel is that kind of like, that urge for help that you feel like, oh, I need to help this person. Um, and you will want to protect the patient in this case, according to you. Uh, but now you're breaking the rule number one, because now you're overstepping. And that's where the healthcare provider are going to start talking and send the complaints. Like it created confusion in the appointment. No one knew like what is going on, why you are getting involved in this stuff. If you will start talking about explanation and stuff, eventually they can assume that you are biased already. You're trying to help the patient here. Not exactly you are right. Maybe they're arguing, and then now you're trying to explain and then help, but eventually it's gonna end up that you didn't help. You just make it worse, right? And well, eventually the complaint will gonna come over like, hey, the interpreter is trying to advocate for the person. Sorry, we don't need that interpreter anymore. please do not book him, right? And that's where the trust also is running away, because now, well, they don't want that interpreter anymore because they do not know if the interpreter can again overstep and will protect someone else, right? So here you have to create the boundary for yourself. That's where you have to keep in mind that what you feel right now is not exactly the thing that should be done. And it's not always correct to be done. So whenever, let's say, that situation is happening, so the number, I would say number four or five things that you need to be always aware is, like I said, do not explain anything. It will not help anyone. It can only make worse. Do not have those side conversation with the patient and now tell them like, oh yeah, well, in my family we did this in that way, and this treatment will be better for you than whatever doctor said. So no, you don't want to recommend treatments or anything that can help. You're still stick to your role. Again, any opinions. So you don't want to go in both ways. You don't want to tell the doctor your opinion, and you don't want to tell the patient your opinion. You're still over there. You have to be neutral. Again, for the accuracy, you cannot omit any, like you cannot skip those sensitive topics and sensitive words and information, because that is the reason why they came to the doctor. And that is the reason why they need help. So you have to be sure 100% that you can attend this medical appointment, that it will not make you uncomfortable, or you will not gonna feel in the middle of the session that, oh yeah, I don't want to do it anymore. And now we have to figure out how to help the patient, because eventually the interpreter just went home, right? So in that case, we have to keep that in mind. Again, side conversations, especially if the doctor is gonna leave the room or you stay one-on-one with the patient, no, absolutely no side conversations. Do not offer them like, oh, I can give you a ride after that, maybe, or let's go and grab a coffee after that. And or you're just gonna talk randomly about something. You are not there to entertain the patient, and the patient is not also to entertain you. You guys are not friends. You are their professional, and you have to react. You have to act in the professional manner. So if that patient will try to have a conversation, I mean, still you can politely answer to the question, but you want to end the topic as soon as possible, right? Don't tell them right away, sorry, I can't talk to you because Peter told me that. No, that's just gonna scare them away and make them not trust in you, right? But yes, you have to like politely tell them, well, we should not talk about this topic. Like I'm here to help you in the interpretation, and especially if that side conversation is going like, oh, so what do you recommend? Maybe I should skip those pills the doctor told me, and maybe I should take those. What do you think? And now, yeah, that's where your answer is coming straight. Sorry, I cannot help you. I'm not a doctor. You have to talk to the doctor about this, right? So for that, again, you have to be sure, and you have to read the room. You have to read the situation and what's going on. If there are bad news coming up, well, you cannot soften them, or you don't want to make them like, if it's bad news, don't make it worse. Just say exactly as the doctor says, right? Because if there are bad news and you start maybe make it a little bit soft and it doesn't sound that serious anymore, well, in that case, it can also kind of like they're gonna have a different influence on the patient, right? And their perception, and if there's family, and how they're gonna react. So, a lot of different things to look into that. All right. So now, what is the actual protocol? And here is the protocol for you opposite, because now you need to also know when you can step in to help. And that's where it can be start getting confused, because all those time everyone are telling you you cannot step in, and now you will hear that yes, there are options where you can step in, absolutely, and you can help and you can assist. So again, you are a neutral person in this meeting, but if there is that awkward silence, for example, be like in the room, like they want the doctor try and talk to the patient, and they're just stay silent, and that communication basically going nowhere. Well, that's where you can ask patient if there is anything maybe they need, or if there is anything the doctor can help them. So here you can ask some questions, because the doctor do not will understand that anyway. If it's not harming the patient, or it not will affect the patient or their treatment, you can ask those questions, right? Now, another very important part where you can step in is whenever the patient, when it comes to patient safety, right? If there is a risk of their safety, maybe they if the floor is slippery, for example, if they might fall from the chair because they're gonna sit right beside you. So yes, you can help them out. There are situations where also it's you might be the only person in the room with the patient. So you have to know how to quickly help that patient. Like, I mean, not yourself, but let's say how to call the nurse quickly. Maybe just get out from the room, run to the nurse or to the doctor if there is something happening in the room. So you need to keep eye on that and be aware that now you're in the medical settings, and if something will happen that can risk the safety of the patient, you need to be aware of that. So that's something that just better keep in mind, because, well, if they're gonna start collapsing, you just don't want to move away, right? And it's like, nope, because Peter said I have to be neutral, so I cannot help you anymore. So no, don't do that. There are options where you can step in for sure. Now, if there is absolutely you have no doubt about misunderstanding, so when they're just two parties talking and your session is taking like 15 minutes already and there is no conclusion, like there is nothing happening, eventually, yes, you can kind of like interrupt them and just tell the one of the parties or both of the parties, like, just go to the topic, right? And you can clear that misunderstanding between them. So that's, again, that's your judgment in this case, and you as an interpreter will know when it's coming up and when it's happening. And same thing, like if the patient is trying to speak in English, so again, you can allow them to speak to a certain point when you can have 100% assurance that there is nothing affecting their health or the treatment, right? Cultural things. So definitely, if there is any cultural context happening, And that cultural context and that cultural differences will block the communication between the healthcare provider and the patient. Well, that's where you can step in as well, because here you can explain the doctor why the person doesn't want to talk to them. What can be the cultural boundaries here that the doctor need to be aware of? And well, who else will be there informing the doctor better than you? No one else. No one else. So those are the times when you can step in, but you have to keep in mind that still you're in a professional environment. Whatever you are saying, it need to be transparent as well. And well, if you have to explain something or help with something, just do it quickly. Just do it quickly, because now you don't want to spend another hour or two to explain to the doctor what's going on, and eventually the appointment will end, right? So if we're like think about this, the best option will be here if you can ask the doctor. Like interpreter will like to, let's say, clarification, because the patient used a term that I do not understand, so I have to ask them again. Or the interpreter need a clarification, or the interpreter need to help the patient understand cultural differences and how they can manage the conversation with the doctor, right? So there's always that something happening that you will be aware. With the time, eventually you might not notice those things at the first time or the second time, but when you will go to the appointment at the hospital or clinic, like for the 21st time, 25th time, 50, you will start seeing those things right away, right? So looking at all those things today, in this slide, if you are medical interpreter, you are there to protect the patient, because they're very vulnerable. They do not know what's going on, and you need to be sure that they feel respected, they will feel safe, and they know what is going on regarding their treatment, their dosage, or whatever is going on. So it's not like you're just randomly speaking and telling the words from one language to another. It's more that you are the keeper, kind of this, like, the integrity for the triangle, because it's very, very important, right? So just keep in mind that you are not anymore just a random person who tried to tell the words. Now you are there in a very serious environment. All right, questions before we jump into the next one?
Yes, similar things for the guiding client. For example, last time the manager says the heart injury is not the same. It's not only at the workplace, and the accusing also they saying she have already diagnosis.
Mm-hmm.
The client doesn't know even about the diagnosis, or the doctor didn't tell her. She doesn't have. She know herself perfectly fit to work. She have no issue before.
Mm-hmm.
So in this between, I asked her if she have those issue before, because she didn't understand, and they push it that way. So it's like a kind of help, and that kind is okay, right? You understand what I mean?
Not really, no. So wait, so she was diagnosed, but she was good to work?
No. The manager pushing the problem, the injury she got at the workplace.
Okay, yeah.
But they're pushing to her like issue she have before. She is not healthy. She had a diagnosis before the doctor mentioned. Blah 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 blah. They're pushing that way or injury,
Okay.
not at the workplace. But even she doesn't know, she have a diagnosis or she never know she have a no issue with that. She doesn't know. She didn't take any medicine or her doctor not mention at all to her. So she didn't understand. I explained her to understand if that is the case before the injury. So that kind is okay, right?
Uh,
But still not understand.
so basically the workplace tried to blame her that the injury is on her because it happened before.
Yeah, that's what they say. They're saying we're not responsible, kind of. They didn't say exactly right away, directly. They want to
Yeah,
push.
I
They
mean
want to push.
here, well, yeah, those are the it happened to me too. It happened too. In this case, that's where like OHS is involved. That's where they have to talk to WCB in this case. There's a lot of different procedures over there, and eventually they need to prove that it happened during the work now, not before. So before you even jump to any like any medication or anything, yeah, she should
They
probably
don't have.
see. Yeah,
They
she
don't have
should.
any evidence, but they say the doctor mentioned already before the accident, and she doesn't know even about that at all. So I explained to her. I asked her. That's what they're saying. Is that what you know? And she said, I don't know even at all. So is that a little bit?
So that means before she didn't have an interpreter to help her out.
Yeah, she doesn't know anything. She whatever they're talking about, they just I don't know. Somehow they created or
I mean,
exactly the doctor say that,
yeah,
but they have no record. They have no. She doesn't have any medicine. She doesn't take a medicine anything before the accident.
yeah,
So
then it can be hard to it's gonna be difficult for her to explain and prove anything. If
So I helped her at that point. I helped her to understand, make sure, and I didn't stop what only they talking on.
Hmm.
So I helped her. I explained her because I see both of them. She talking something else,
Yeah,
and
but now
the
you're
manager.
not, so now you're overstepping because now you are explaining her what are the rules in the
Yes,
industry markets
because
for the
she's not
employees.
understanding. She's not
Yeah, you can't
understanding
do
at
that.
all.
Yeah, so you
Oh,
cannot explain her that.
mm.
I mean, unless you are pretty good educated about the legislation and the rights and the rules for the employees and employers in Alberta, and you are good with occupational health and safety, then you might to provide that information. But if not, I will avoid those topics with them. You can tell them like, hey, you should go and try this website maybe and talk to someone over there because there's a lot. If you just go to the government of Canada or government Alberta website, there is a lot of information people can find.
The
And
problem, the problem, she didn't understand at all what they're talking about. That's the point. That's the big
yeah,
reason for me.
but that was in the past, and that was in the past. And now when you try to explain her anything, and she was gonna come out with all those dramas now and blame people that she didn't know anything, and now
Mhm,
she's the victim of the system.
mhm.
Uh, I'm not even sure if there is anything that she can fight for anymore because she doesn't have any proof, she doesn't have any records.
No,
You
those
only
the
have
people.
some, and then she
The
will
pro.
say, "Well, Mariana told me about this, so that's why I'm coming here now, and I want."
No, no, no. I think we understand in here is a little different. The way I'm saying, like the manager blaming her issue, her injury
Yeah, but how she
about
gonna
her
prove that?
diagnosis.
Yeah, so how she
They
can
don't
prove
have
that?
those people who saying that she have a diagnosis. They don't have any proof.
Yeah,
She didn't mention at all. She doesn't know at all what they're talking about. So I asked her if you should know what they're talking about. That's what I mean.
Yeah, well, I mean, but still, I will say do not explain anything about the labor rules and stuff because yeah,
Okay.
there's just too many. Um, I mean, I was study the occupational health and safety books and the WHMIS and stuff and other parts for different places. And well, I was also working as a supervisor in construction, so I needed to know those safety guards and how the labor work and the rules. And believe me, I still do not know everything. And it's just too much. There need to be people involved in that if we're talking about the employee-employers relationships that actually can know help them out maybe from the legal perspective later on, right? But yeah, if you can, I mean, you can still tell her like, oh yeah, there are some sources that you can try maybe and find help, but never directly explain the like the government rule or like legal stuff. It's just not gonna help.
Okay, thank you.
Sure. Akiko, you have something?
And I was just wondering if those that the question that she was talking about right now.
Oh.
So as an interpreter, it's like we always have the between the patient and the doctor, right? They want us to take their side sometimes. That's that's what I feel. So as an interpreter, we have to just interpret what exactly they say. We have to deliver the message. If they say like you don't know anything, and then we have to translate like you don't know anything. That's it.
Yeah.
And sometimes we have to clarify if the client seems like confused or they don't understand what's going on because they lost. Then we have to go and interrupt. That they say that the interpreter needs to clarify if the client is understanding or not.
Yeah.
Then
Yeah.
we go on the quandary role again.
Yeah. So
That's
that's why
all
this
we can do.
accuracy. That's why the accuracy is important, right?
Yeah, that's all we can say. We can't go in at the between the conversation. We don't know. Like, yeah, I would feel like I have to explain that way, but we are not in the stage in the role we can explain the situation.
No, yeah, that's right. That's right. Thank you. Do we have anyone else? Or we can jump in to the next one. Okay. So now you are the best accurate interpreter, and now you still need to know how to be neutral. So what is this being neutral actually means, right? So a lot of people is saying like, oh, if you're neutral, you cannot take any sides. So you're kind of like a Switzerland between people. But at the end, there's more into that. So if you're doing a medical session, and probably now, I think in this slide, we actually might to answer Mariama your question. So when you will hop into those medical sessions, you cannot help the patient to understand situation. So the word I'm looking for, you cannot influence their thinking about understanding the situation, right? So whenever that's how deep it is going when you have to stay neutral, that even if you will say, like, if you will say yes, but you will not know, that's where you can start influencing their understanding of let's say, the appointment or why this appointment is happening, right? Or the treatment. So that's how neutral you have to be. You cannot do those things. So if you're gonna influence the understanding of the person, because if they're gonna understand something different, it's gonna then also make changes to their decisions. Now, if they're gonna start making wrong decisions, it will have a huge impact on their emotional behavior later on, right? So imagine that there are those little domino blocks, and if you push one domino, they're all gonna collapse in this case. And that's how being neutral is important for the interpreter, because now patient is trusting you. They feel like, yes, you're their protector. You know the language, you know the culture, you're from the same country. They're trying those little chit chats, and they start to feel comfortable. And when something's gonna come up very serious, and there'll be at least a little bit of change in your voice or how they will understand the outcome, that's where it's gonna start collapsing, right? So that's why it's so important to be that neutral interpreter. So in a simple words, saying you basically are not there to help them at any point, and you are not there to help them communicate with the communication to understand and make it easier for them. They are still, it's still the same appointment, like they will be in their own country talking to the doctor as well in the same language. The only difference is here that the doctor is different, right? So you cannot prioritize patients. You cannot show them that you're prioritizing, because that's when eventually going to come up to a big bias, right? And now, why exactly the bias will happen? So the first thing is how you're going to affect the conversation, right? So how you going to filter out language, emotions, how are provided to that? How you going to start kind of like framing those words for the person. Now, some of interpretation and words you might to say like not intentional, and yes, we're just human. We cannot be perfect, but that's where you will have to learn how to manage that and how to keep those boundaries and how to figure out what and when you can do. So eventually, it cannot be looking like, it cannot look like it's a bias, because now you are influencing the person. You make them. That's where you put them on the priority, and eventually, doctors, healthcare providers, they can start noticing that, and again, you might be replaced right away. Now, other biases that coming up are not exactly related to the interpreters and interpretation itself, because if we look a little bit deeper for when those biases can happen, it always starts like, let's say, there might be a cultural difference, right? Maybe personal beliefs of the patients. So that's, again, something can happen. That emotional language of the patient. So there can be a lot of different things. Also, stereotyping, again, we were talking about that. So stereotyping can affect how the messages are provided to the doctors, right? or vice versa, pretty much.
Yeah, it's sometimes it's sad, like, you understanding what's going on, the topic, like, exactly something like a same topic and different topics, like at the same time the doctor asking about her health. Did you have a before diagnosis? Did you know that? And she talking something else, and
Yeah.
she might, like, that person might get the, like, good treatment if they know exactly where she are. But if they don't know, one say other thing and one say other thing, and then you are there, you understanding the situation, you cannot explain and you cannot solve the problem, and just saying whatever they say. Little sad, isn't it?
Well, I mean, that's how it is. Well, that's why we are here to help people out over there and figure out and make it all happening, right? So, yeah. Oh, where did I stop? What were we
Sorry.
talking about? Yes, the bias. So, bias, at the end of the day, it can be very dangerous eventually, and it will affect how neutral you can be, and it will challenge that. And pretty much, if you will start taking a role in like those high risk appointments, and you will be biased, there might be the problems like happening again, from maybe a simple changing a word to again changing the sentence to changing the entire idea of the spoken words and taking the role of a personal guardian of the patient. So when those things are coming out, it will start being pretty dangerous. And the interpreters need to be aware of that, that you can slip on that very, very easily. Because if you are emotional person, for example, and you see that, okay, that person is suffering, I cannot do anything else. I have to help her out, right? So that's where it can get the problems home. So you, as an interpreter, need to be sure if that those things will not happen. So to fight it with the bias and how to stay neutral, well, number one, you have to keep eye on yourself. That's where you're setting up those boundaries. That's your kind of like a self-monitoring yourself and your behaviors. You have to be aware of the situation and you cannot let it slip. Again, if you might be an emotional person, it might not show in your behavior, but it will show in your words and how your words will be delivered. Now, your tone will change. The way how you're speaking will change. Maybe you're going to start providing, interpretation in your language, like in the slang, more friendly way, and that's where the patient going to start noticing the changes as well. That okay, so now, yes, we are friends, right? So yes, as an interpreter, you have to be alert during those sessions, and you cannot let it go at any point. If you need a break during the appointment, just tell like yes, the interpreter is requesting for a short break, and it's better to like maybe go out from the room, like go to the corridor, stay on the corridor, just grab a glass of water, and take a quick rest before entering the room again, right? Another thing is well, learning daily, and how you can pretty much improve from session to session. You will probably see where are the gaps and where, let's say, you're struggling emotionally, for example, or where are the gaps in your accuracy, right? If it comes to like putting the patient as a favorite person. So you have to be self-aware of that. You have to be self-aware of that because, well, we cannot just, take out your brain and put a machine inside to not have anything. But also be aware, yes, there will be emotions during those appointments. Not all of them, but eventually, when you will start progressing with your skills and how you are doing everything, you will start getting assignments that will be also more difficult for you. And if now you're doing, let's say, a random physiotherapy at WCB, then you will do more complex appointment for the private clients. Then you hopping into medical settings itself when you are at the family doctors, private clinics. Eventually, you're gonna end up at an open heart surgery on the ER, and that's where they're gonna need an interpreter. And then at the end, you might end up at those sessions where there is like something really bad seriously happen, right? So those emotions will be there still, but you need to be eventually aware and fight with that to not show those emotions during those, let's say, 2 hours of appointment. So that's something very important. So when neutrality feels like you're breaking, and when it feels wrong. So usually it slips very slowly, and well, you're not gonna hear that. You will not probably realize when it's progressing, and eventually the next thing that you're gonna notice is like, keeping hugging the patient and telling like, don't touch him, right? So that can end up like this. So the first pattern that you should always watch is emotions. So that's number one. And now you have to align your emotions with the patient emotions. If they cry, well, you cannot cry. You have to be kind of opposite all the time. If they talking serious, you still need to, in a professional way, talk serious as well. You are not now gonna start laughing, right? So there's a lot of different things when you will need to eventually align with the patient and understand whenever you can use those emotions and when you should not use those emotions. And that's where the patient also going to start noticing like, okay, that person actually knows what they do. And the doctor is going to see that too, right? So for example, if we took someone who is scared or they are like overwhelmed of the situations, maybe they feel in pain. So by by our nature of being a human, you will eventually start softening words, and you will start to try and make that patient feel better how you delivering the words, right? And on the beginning, yes, you will not start noticing that, but at some point after an hour or 2 hours of the appointment, you're going to start noticing like, okay, I just made a very big mistake. And now you're totally softening everything. And now instead of doing actual interpretation, you're just telling them as a good friend what is going on and what the doctor is saying, right? And that's where, it's happening when the patient also, when they're showing that they trust you, and then you have this relief. Okay, they trust me now. We are safe. We're good now. They're a little bit scared. I can maybe I should deliver those messages a little bit different. So that's when it's gonna start collapsing. And sometimes you will find the right time when to adjust. sometimes not. So you have to be aware of this whenever you cannot. If you are doing the adjustment, if you are doing adjustment, well, that's great. You are just learning from your mistakes, and means that you are self-aware of the situation, and it's gonna be only better, right? But if you just let it go and you were say, okay, there are only 20 minutes left, I can just keep going like that, that's fine. Well, not. Because now, in the next week, the same patient, yes, they're gonna request for you, obviously, because now you guys are friends. And they are aware that you will do the same procedure as you did the last time, and now you'll be friendly and emotionally available for them, and you guys are gonna be friends, and now they're gonna expect from you that you're gonna be biased for the interpretation, and you're gonna favor them. So yeah, there's a lot of things. So usually that's why the patients, like the claimants from WCB, probably also asking for the same interpreter, because they start feeling that connection, right? Of course, I'm not saying don't show anything and don't act like a machine, but you need to be aware of the situation, and that you can slip very, very quickly, and people will start seeing that. Eventually, it will end that you guys can start sharing each other phone numbers, email addresses. Okay, here's my Facebook profile. Let's share some Instagram here. Let's be friends and stuff. And you're not going to even realize at which point you will start also helping the person because they want it from you. And that's where the abuse can start as well, because now you want to help the person, still you feel bad for the person, and you will say, okay, well, I can help. I can do, let's say, those translation for you. I can help you at the court. Yeah, no problem. Oh, you go into the doctor tomorrow? Sure, I can help you with that too. And after that, you come in after 30 days to send out translation asking where's your money, and everyone said like, oh, we have no idea what you're talking about, right? Obviously that's the little bit jokey side, but at the end, yes, you'll be abused. And people are people, I'm not saying all people are bad, but people are people. And if sometime people will see that you are a good person and you're trying to help, they will use that against you, and they will ask you for favors all the time. So that's pretty much where that domino blocks are, like, just keep collapsing all the time. The other idea how it breaks is like, if you are with a provider and there is like, you feel like their authority, or like you'll feel kind of affected by the person, like maybe there's a surgeon or like a high stake specialist doctor. It's not just a nurse anymore. It's not just a person randomly approaching. Now you're dealing with some serious situations, and the actual doctor specialists are coming up to the patient and going to talk about the serious part. That's where you're going to start identify this authority of them. It's usually happening in the legal settings, but in the medical part, there is a lot of situations where it can happen, and people can feel a little bit intimidated by that, right? So you will try, most likely, run away from there as soon as possible, and that's where you're going to start to simplify everything. So you're going to put explanations in the and simplify those explanations in the interpretation. You're going to skip some questions. You will start doing, like, your interpretation will not going to be accurate at all, because now all you want to do is just run away from there. And here it's a good part, because it's not like it's going process by process by process. Here, usually people can notice that right away in themselves, like, okay, I don't want to be here in this room. And that's where it happens. Like I said, usually in the legal settings, when we have, let's say, in the example of our company, when we sent interpreters last year to the court hearing, which was a sexual assault case, and the interpreter said like, oh yeah, I can handle that, that's not a big deal. We showed them like, here are the charges, here's what they're gonna talk about, and eventually after 15 minutes at the courtroom, interpreter said, no, I cannot handle that anymore, I want to go home. And she felt like very overwhelmed. There were people everywhere, police officers were everywhere. The whole procedure was very, very, like, strict, professional, like a court hearing. But that was the thing when after that one incident, that's where we came out with this whole idea that we need to first figure out if people are even able and handle to provide that interpretation. And since then, after that one accident, nothing like this happened ever again. So, yeah. But eventually, as an interpreter, you're gonna start slipping here because you want to finish the interpretation right away, and you don't care about anything else. You just want to leave the room. Another thing is when you are not very transparent and you are recognizing, those misunderstandings where you're supposed to step in and you just don't care, right? That's also when you're not neutral anymore. You just pretty much don't care what's happening. And in that case, it will affect a person very, very dramatically. So if there is no transparency, if you should step in, but you're not doing that, you just let it go, you just don't care, it can affect that very, it will be critical. So especially when you have to deliver those, very important information, you will just, yeah, I don't care. So it's kind of like you don't want to participate kind of in this session, right, anymore. So how to be neutral and kind of just still have that compassion for the person, right? So those kind of like critical things. So your behavior versus how neutral it can be in those situations. So a lot of interpreters struggle with this because, again, it feels like it's kind of like you have a battle in your head now. It's kind of like your moral compass is affected and now it's in a conflict. And now you do not know what you should do. And where that, when you're trying to be neutral, but now you're gonna be trying to be so much neutral that eventually you're gonna totally be like separated from the conversation, right? And that's where like this the protocol of machine is coming up, where you are totally like cold and there's no other emotions, you're feeling nothing. You're just going with the words and that's it. So it will not help because, again, not only the patient but both parties gonna feel like something's off. If you do not act like a human, well, it's gonna be weird. So you have to be aware that you still being neutral. It doesn't mean that you have to be totally like detached from the conversation, and just living in your world now, and create a bubble and totally separate from them. You can still provide the information, as it's supposed to be, with the tone, with the emotions and other things, but still stay professional. So in this case, when it comes to how to deal with that moral compass, I would say you are an actor now, and you need to know how to play a role, right? And when you finish playing your role, that's where you're going home, and you're going back to your life again. So that's something that you guys can consider. So if we're talking again about your behavioral, like how you behave, it need to show that you are there for the people. And again, the patient needs to feel safe, right? You're not showing the patient that you are just abandoning them totally, and you're not gonna kind of like be with them, right? So you have to be sure like what kind of decision you're making whenever it comes to being a neutral person, and when to not go in the other way, either too emotional or not emotional at all, and be totally like cold, right? So that's something that will probably will come with time, and everyone will learn how to work with this. So going for the end and like the ethical intervention. So how you can intervene without losing that neutrality again. So neutrality is not exactly something that you have in you all the time, because we are all probably biased about different things. We have our opinions about different things. We all are different. We have different backgrounds, and there's a lot going on. That problem, we are not neutral. By nature, we are not. Not a single human is neutral. So here is more how you will put your discipline on, and that's where you will be exposed to all those emotions during the medical sessions, and you will need to put together, combine together this emotional exposure and your discipline, right? So that's very important, because again, if you let it slip, you don't want to do that, right? So it will affect everyone in the room, and that's the last thing you want to do. So eventually, how you can, I would say you can practice a lot, especially for the WCB appointments. If you're doing those, you can practice during those appointments, and you will eventually see yourself after each appointment. You can figure it out. Okay, what did I do wrong today, or what did I do amazing today? So that's mostly something that will help you. Now, talking about like this whole thing today, you have to keep in mind that you will be the most important person in that sessions, and people will trust you. Doctor and the patient, their families, they will trust you, and you must be sure that you will not break those situations, because that's going to be the last thing they want to see, that you will deliver the bad news and you will actually start crying before everyone else don't even understand what's going on. Same thing with the opposites. If there's, you have to be neutral with delivering those messages. So you don't want to let them know ahead what is actually going, good or bad, And that's something that will be very important, especially if later on you're gonna jump to those very high risk critical appointments. And I don't want to, hear that you just run away or something happened and it triggers something in you that you don't want to do it. But from the other hand, again, that's why we're doing those trainings, so all of you can understand that there's a deeper meaning in this interpretation. It's not just randomly saying the words anymore. Like here, you actually dealing with people, and your decisions can affect those people. Even a simple coming late to the appointments, it will affect the person, right? If it's a hospital or it's a clinic, the patient is waiting there and they are already scared of the treatment or something, they're already like overwhelmed with this situation, and now the interpreter will say, okay, well, I'm late, I'm gonna be there in 30 minutes. So now this poor patient need to sit there in those 30 minutes again and wait for you guys, and it's not gonna help. So keep in mind that, again, you are there to help them. And a lot of people, and it's both in medical and legal, they rely on you. There's a lot of people involved in those appointments, and they all rely on you because you're the most important person. So yeah, that's it about the accuracy and being neutral. Hopefully we can skip a little bit about that. So what's gonna happen now? So tomorrow is Friday, and I will finally finish all the writings, all the cheat sheets. Today's module, I will send it tomorrow morning. I should be uploaded probably by afternoon as well. So by the weekend, everything will be there. On Monday, we're gonna make a summary, so you guys can decide. We're pretty much the same people all the time anyway, so you guys can decide which you want to do it first, legal or medical, or you want to do both of them on the same day, and also with the exams, which one you want to do first. So think about this over the weekend, and we can go back to this chat whenever we do the summary on Monday. And then Tuesday we'll do another summary if we need for both days. And Wednesday, Thursday, Friday will be the examination dates for both legal and medical. And after that, so that's going to be in 2 weeks, right? 2 weeks. After that, we're going to finally hop in to some serious stuff. How about that? Are you guys very excited for the serious stuff? So for the legal,
You mean, Peter?
what's
Serious
that?
stuff.
Oh,
What do you
well,
mean by?
I mean, well, now
serious?
we are kind of in the kindergarten still. So the next modules that we're going to work on, let's say example for the legal, that's where we're going to start talking about your preparation, pre-trial preparations, all the sensitive topics, all the conversations you'll be involved, the lawyer-client relation. After that, we hopping in from the law office all the way to the courtroom, and we're going to talk about the courtroom procedures, the protocols, what is going on over there, what is the ethic, dynamic of the place. And eventually we're going to jump to high pressure courtroom performance and complex and sensitive cases. So yeah, starting in 2 weeks, we're going to talk about more serious stuff.
After this 5 modules, right?
Yes.
The other 5.
Yeah. Well, for legal, it's going to be 4 because we already went through 6. So And then today we have 5th for medical. So the next modules for medical will be, again, connecting to today's topic. We're going to talk about how you can handle sensitive and emotional encounters. That's where the actual topic are coming up. After that, we're going to hop into ER. We're going to hop into trauma scenarios, how you can work under the pressure, staying calm, staying neutral, work with family, work with caregivers, communication between them. And eventually we're going to end up at the critical session, simulations. Yeah.
That means after the test, after board.
Yeah, after that. So,
Okay.
yeah. So now those modules will be very heavy, very with the sensitive topics. Well, yeah, if you want to hop into, let's say, criminal cases at the court, you want to do the critical appointments at the hospitals, you want to be assigned. Eventually, let's say if you will also do some certifications and you actually want to work at the hospitals, maybe you need to have at least some kind of background to understand where you can end up during interpretation and how the situations can escalate very quickly, right?
Okay.
So that's something that first I want, well, I will not say I'm trying to educate, I will say I'm trying to help. I'm not a good educator, but trying to help.
No, you're so good so far. Thank you so much.
But other than that, thank you. But yes, I want to get you guys ready because WCB is, yeah, it's just a sandbox. Let's be honest, it's just a sandbox, and the real life starts like right at the court and also at the hospital. But there is a price. There is a price, and that's how it will eventually. It can affect people emotionally. Again, there is a other side of this coin that, well, your rates will go up, right? You can get better money eventually doing those high stake sessions. Who knows? Maybe you will start working in immigration and in the different places, police stations and stuff. So yeah, you can find so many different directions in the interpretation that, especially now, it's just progressing. It was not that popular, I would say, like 5 years ago, 10 years ago, but it's way more popular now.
I hope I will be at immigration.
Yeah, there you go. So, but even in the immigration, you don't want to see, you know, a couple guys just, you know, smuggling some stuff, and now there is a drama, and you know, people are fighting.
I'm totally good with emotion. I'm not cry easily. I'm not that kind of person.
Yeah.
But only when they're misunderstood because this person doesn't know the English or something barrier. That's only choking me.
Yeah, but now you're gonna
trust
start
me.
feeling, so you still feel sorry for them. You try to empathize with them. So now you're biased already. There you go.
Sorry about that. But
Right?
I won't do that anymore. So
Yeah.
that's what I was like. I'm not easily cry, like I said. I'm not that kind of emotional person.
Yeah.
So
But you never know. I mean, you never know. It can happen, right? I will also try to prepare some of the negative feedback from the locations about the interpreters, so we can go through that, and that's going to be our case studies.
Sorry, I interrupted you again.
Yeah.
Are we gonna get a certificate after everything?
Yeah, some people actually are getting them already.
Oh, that's good. Thank you.
Well, I'm not. I will say not. It's not a certificate. It's more like let me see if I can see that here.
At least like something to prove, like I did that.
Yes, there will be a proof. There will be approved, and eventually we're gonna assign people to this stuff already. I'm not. Some of you probably already received some evaluations from me and certificates. So let's put my name here. All right, we can share this, I guess. So we can see the price. All right, there you go. So eventually you guys gonna get that.
Wow, that's nice.
So yeah, after passing the exams. Like again, it's not a big thing, but it's kind of like it shows us, okay, that you actually care and you wanted to educate and work on that.
That's
So
right.
and we are going by the tiers, so all of you will be assigned to the tiers from the beginning. And yeah, the examination will also help. So it's
Thank
not
you.
like everything is just for fun. No, it's not. No, it's not.
Yeah.
Especially
Still
now
something that
we're gonna go more professional and there'll be more probably training coming up. So we'll see.
Thank you. Thank you.
All right. So yeah, let me work tomorrow on everything for you guys, and then we're gonna meet on Monday, same time, 3 p.m. And then we just probably gonna have a more like a chat thing to exchange the ideas. I'm not planning to go through all the slides, but probably the most important things from the last 5. So we'll see how it goes. Okay.
Hi, Peter.
Oh yes, hi.
I'm sorry, I'm gonna bother you with
iPhone.
the same thing like
Yeah,
yesterday. I'm still waiting for the PDF so I can
I
study on the
know.
weekend.
Well, that's what I'm just saying. That give me time till tomorrow.
Please, because we're gonna take
Uh,
advantage of the weekend. That's
I
why.
know. Yes, I'm trying my best, but there's so much going on in the office and so much going on with the projects that, yeah, I actually gonna need an assistant probably eventually.
I can be your assistant if you want.
Uh, well, I don't know.
Okay, I'm joking. Thank you.
Can
I
do.
need someone like me to can handle stuff. So,
I
but
was
yes.
your assistant before. You forgot that already?
Oh yeah, but since then we changed a lot of rules. So
Mm,
uh it's more demanding thing now. So
mm,
and that's because yes, we start to cooperate with actually provincial governments and here
mhm.
also while we're hoping there'll be more work for everyone as well.
Yeah, thank you.
Oh,
All right,
Peter.
so yes, who was that?
Sorry, yeah, that's me, Akiko.
Oh, okay.
Sorry, I just a general question.
Mhm.
As your agency, what language is the most like a demand for now?
I don't know. I will have to check out
I
the
just
report.
wonder.
Well, probably
Punjabi, I guess.
the most 5 will be
Oh,
Punjabi, Arabic, Cantonese, Mandarin, Spanish, Ukrainian, Russian.
okay.
I would say. I know, Akiko, you're such a poor soul over there.
No, no, no,
But hey,
no, no. I mean, just
whenever we have
saying that.
something, you are always the first one. So
Yes.
don't worry.
Yeah, I'm not saying that, it's that the thing, but yeah, I just wonder. And another the question is in AHS,
Uh-huh.
you are yeah, Santa translation is getting more assignment from the Alberta Health.
Mhm.
Yes.
Yeah, yeah, yeah.
So is there any it was just a suggestion. I will send an email to you if you can you are open to the things maybe better for everybody.
I mean, sure. Any
Yes.
ideas? Yeah,
Yeah.
if you guys have any ideas, send me ideas. I like new ideas. Something we
Yeah.
can work
Okay.
with. Yeah,
Okay. Yeah.
absolutely.
I will. Thank you, Peter.
Sure. Abby.
Hey, yeah, I just have a quick question. You were
Uh-huh.
saying something. Hello, can you hear me?
Yeah.
Okay. When you were saying that working with the federal, does that mean provincial as well? When they ask for us to get interpretation,
Mhm.
what kind of information do they get when we do that? We are the interpreters. They just get the first name, last name, or they ask for a history about.
Yes, they do. Yes, especially currently the government of Alberta and the court, the entire legal system, they are checking your credit first. So they are asking usually for your background, for your experience working with us. They asking for your resume, the most updated one. And then they will pretty much deciding if you are qualified or you are not.
Okay. Also the criminal records as well, right?
The criminal records, it's not going to the court yet. They start kind of like slowly smuggling those questions, but for now, I mean, I have maybe 20, 25 out of 600 people, so I'm not even telling people right now at the court that we have it, so I'm avoiding the topic, right? However, like if they push for this and they actually say like, okay, either this or not, well, then I have to provide it. Provide the interpreter who will have that currently.
Okay.
So yeah, we'll see. I'm guessing in the next couple of months, it's gonna probably improve and they will start asking for this more often.
Okay. Okay.
From the good part, the good side of it is that whenever we provide the resume, if let's say you're doing an appointment tomorrow, we provide the resume and your credentials. If they approve you, they are not asking for this again.
Okay.
So we don't have to do it every time. So pretty much for all the interpreters we are currently assigning to the legal sessions, I'm also providing like a quick assessment note, like evaluation done by me. And then I'm also kind of like trying to push a little bit more like, oh yeah, so here Abby was working with us since like, let's say 2025, and she did 50 legal appointments, for example, right? So the reason why I'm kind of like trying to enhance it a little bit, because I also want you guys to practice. And where is the better time to practice if, you know, not at the
Yeah.
right?
Yeah. If it is,
So if let's say if you are doing only physiotherapy all the time, WCB, and you have totally zero legal appointments, and we're gonna assign you to this, so most likely we can assign you first to something easy, right? So maybe insurance company and car accidents or motor vehicle issues, or you know, something where you can still kind of like find yourself. And because for criminal cases there is no, yeah, we cannot do that. That would be like, it would just go against myself. And from the other hand, also the court probably will not approve just random, you know, resume
okay.
for the court. But yes, I'm trying to push everyone. That's why I came out with this idea. Whenever we hear that, okay, we're working with courts, that's why we need more people to cooperate with us in the legal settings, and that's why we're here.
Okay. Okay. Thank you.
Okay. Sure. All right. Any other questions, or are we going home? No? Good. Fine. So yes, we'll be in touch. I promise, Amani, I promise I will send everything tomorrow. And you guys can have some cheat sheets. You will have the videos in there. You will have the PowerPoints. So all materials I have currently here, everything will be sent to you tomorrow.
Do we have a
Salam
class
alaikum. Yes.
Yeah.
Sorry.
Hi.
Hi,
Do we have-
Peter, and hi, everyone. I was just wondering if there's any possibility that we can, those people who speak the same language can be in the same group so we can just help each other in,
Absolutely not.
yeah,
What?
absolutely not.
Absolutely not. Are you guys? So wait, so you're gonna now try to cheat and talk in your language so I cannot understand who is helping who?
Oh, not at this time. Not just for the exam, but for the future.
Oh, like for the webinars?
Not for the webinars, not for the webinars, but for the future, like working if you need any kind of terminology, you might help each other, or with this speaking the same language, you might know different expressions from
Oh, okay.
different people.
So you want to create like a big team of interpreters, and then you can exchange the stuff between you. Is that correct? Like the vocabulary? Okay. Well, that's something I guess I cannot decide for people. I mean, like, yeah, some interpreters know each other probably, either from, you guys are at the same locations anyway. So I'm guessing there's a lot of you that, already are on the private level between you. But yeah, I can't just randomly tell, okay, so now we're gonna work for everyone together, and now here are all your phone numbers and email addresses, and you guys can start chatting and sending messages to you. So no, I cannot do that. I'm kind of bound by by internal policy. So but yeah, whatever, if you're doing something in your private life, go ahead. I have nothing against that. That's that's not work related at all, right? If you are talking about those things, that's even better. I don't see the problem if people can share their experience with others. Yeah, I don't see a big deal, but I can't officially do that.
Yeah, I get it. Yeah, I get it. Yeah.
All right. Okay, so we're done for today.